All right, I'm in chapter 10 of the fundamentals book, and we are going to cover medical and surgical asepsis. So let's first talk about hand hygiene. So you can obviously wash your hands with either soap and water or an alcohol-based product. So it's important that you use antimicrobial soap and water versus an alcohol-based product under certain circumstances. So those circumstances include when your hands are visibly soiled, before you eat, after using the restroom, and after contact with bodily fluids. It's important that you scrub your hands for at least 15 seconds, and you should dry them with a clean paper towel before you turn off the faucet. If you're using an alcohol-based product, you want to use between 3 and 5 milliliters of the product, and you want to rub your hands continually until they become dry. So this chapter also goes over some practices to help prevent the spread of microorganisms in the hospital environment. So here are some basic things that you need to know. You want to cover your mouth and nose when sneezing or coughing, and encourage your patients to do so also. You want to have your patients use tissues and dispose of them properly. You should stand at least 3 feet away from those coughing, or have them wear a mask. You should keep your nails short. You shouldn't have artificial nails or use gel polish, as that increases the risk of microbes being in there, bacteria. You should perform frequent hand hygiene and remove jewelry from your hands and wrists so you can really get those areas clean as well. You should never shake linens in a room. This kind of can spread germs around. And when you're if you're cleaning up, like cleaning up the bedside table or anything in the room, you always want to clean the least soiled area first and then move to the more soiled areas last. And you should never place any items on the floor, even linens or anything that you're going to be getting rid of, because you should just assume that the floor is definitely contaminated. All right, now we're going to talk about how to set up a sterile field. So when you have your sterile package, you want to position it so that the top flap is facing away from you. You want to open that top flap away from you. Open the right flap with your right hand, open the left flap with your left hand, and then finally open the last flap towards you. If you are needing to use a sterile solution, you want to remove the bottle cap and place it face up on a clean surface, so not the sterile surface. You want to hold the bottle so that the label is against your palm, and you want to pour a small amount of the solution away, about 1 to 2 milliliters. And then you want to pour the solution onto the dressing or the site, making sure you do not touch the bottle to the site on the patient. Some other key points in terms of maintaining a sterile field. You do not want to cough, sneeze, or talk over a sterile field. You should definitely know that the 1-inch outer edge of the field is considered not sterile. So any item that comes in contact with that outer one edge is considered not sterile. Any object held below the waist or above the chest should be considered contaminated as well. Any objects that need to be added to the sterile field should be added at a distance of at least 6 inches above the sterile field. Should be dropped into the field at least 6 inches above that field. You never want to turn your back on a sterile field or reach across a sterile field. And then finally, any sterile item that comes in contact with moisture should be considered non-sterile. So those are the key points about a sterile field. I would definitely know those. And we will stop here and pick it up with chapter 11 in my next video. Thanks so much.